Welcome everyone to our webinar today on low-level laser therapy in orthopedic dysfunction. And this is going to go into from chronic pain to functional healing. So my name's Tom Garrity. I'm a laser user myself in the field of exercise physiology. And today I'll be your host. Firstly, I just want to say a big thank you for everyone joining our webinar. You know, the field of low-level laser therapy is a very exciting and rapidly growing field. And you guys are all going to be gaining a great wealth of knowledge and deeper understanding into this science within this next hour. And so I'm sure you guys are all going to have some burning questions. So feel free to type them into the, there's a question box here throughout, so you can just type them away, and we have some time at the end for some quick Q&A, and we'll answer them at the end. And with that, I'm very excited to introduce our speaker today, Dr. Kirk Gair. Kirk, he's an internationally renowned chiropractor, and he's also a very, very expert in the field of low-level laser therapy. He's had over 20 years experience in treating professional athletes, world record holders, and patients with really complex conditions. Since 2024, he's been integrating laser therapy into his practice, and he continues to have remarkable results. People from all over the country come to visit him. And he's also had a lot of contributions into clinical research studies in the low-level laser therapy field. So we're very privileged to have him speak for us today over in the US. And with that, I'll pass it over to Kirk. So Kirk, over to you.
All right. Thank you, Tom. And thanks for you guys having me on here. I'm excited to share this information with you. Like Tom said, I've been using these lasers for over 20 years. It's 21 years now. So I've seen amazing changes in how it helps patients' health. And I really want to share with you all what we've been able to accomplish with them. And my goal in this webinar really is to kind of turn you into a laser Jedi master is what I really want to do. So we're going to show you how you can use these different lasers to really help patients to heal up a lot faster. I've gotten invited to work with some pro teams like the members of the Los Angeles Dodgers, some of the athletes who won the world championships there. And I've worked with some people holding world records here, like this kid, Zach Shinnick. And he's an amazing athlete in that he had a great physical therapist helping him and a great chiropractor, but he kept having chronic hamstring strains, and that was keeping him from competition. And he was thinking about stopping running, and utilizing the lasers both on the area of the problem and on the brain, we were able to stop those injuries from happening. I'm going to show you how we do that in this webinar here. We were able to stop those from happening, and he ended up setting a world record in the Pan Am Junior Games in the 400 meters, winning a gold and a bronze, and continuing to set national records here in the United States in the 400 meters. So we were able to get him to recover from that chronic injury, but then we even enhanced his speed. And that's one of the big things when we're using these lasers on the body and on the brain, is that you can enhance an athlete or you can enhance an everyday person to get them to do whatever it is they're doing, whether it's work or whether it's a sport or whether it's brain function. You can get that to enhance and function even better. I got invited to come and teach this to the Los Angeles Lakers, their famous professional basketball team here in the United States, to teach this to their trainers because they're having these chronic injuries. And when I went in there, I was met by this gentleman, Kurt Rambis, who was a famous player for the Lakers back in the 80s, winning many championship titles there. And he had a chronic shoulder injury. I'll show you later on in the section how you can utilize these high energy photonic lasers to repair tissue, even in a case like his where he had been stuck for years, not able to lift his arm up after a surgery, and he had constant throbbing pain. I utilized the FX and the green and violet laser on him, and in a 10-minute session got that throbbing pain to stop and improved his range of motion, which really blew him away and got him excited about trying to utilize this with the Lakers. So I like to start off with showing you a case study here. This is Bethany Flores. She's the wife of the Los Angeles Lakers strength coach, Randy Flores. And so with Kurt Rambis, he's the vice president of basketball operations for the Lakers. He wanted to try to guinea pig somebody, and Bethany was the perfect one to choose. So with Bethany, she's a professional CrossFit athlete, and she had had chronic pain since she was 12 years old. And her pain had been so bad the previous year that she was unable to compete in the CrossFit championships. Now, she had tried everything: chiropractic, physical therapy. She had her own home red light therapy device. She had done different types of injections. Nothing was helping her, and she had to sit out of the World Championships the season before I saw her. So what we did with her is we had her come in, And we combined utilizing the FX, which I'll show you a video of that in just a bit, along with the green and violet laser. Now we would do a 20-minute session on her with the FX on her back, and a 20-minute session with the green and violet laser. And this is all automated, so you don't have to be in there with the patient the whole time. You can literally set the laser up around the patient and let the laser do the work. She had chronic low back pain, plantar fasciitis, and neck pain. We had 8 weeks to get her ready for these, to try to compete in the CrossFit Games. Her pain was an 8 out of 10. She said if she could just get down to a 7 out of 10, she thought she'd be able to compete. Well, in 8 weeks of doing this, she got down to a 0 out of 10. And that was the first time she'd been pain-free in 18 years. She was blown away. She competed that year and finished 15th in the world. Then we did it again on her this year to enhance her performance. And what was really amazing is this year, Bethany, when she completed in the World Championships, she finished #1 in the USA and #4 in the world. So it's a huge, huge deal. And the great thing about this too, for those of you interested in the Erconia lasers, is she's going to be partnering now with Erconia for the next several years, doing promotional videos to promote what the lasers do for these CrossFit athletes. And there's a huge market out there who are looking to not only get out of pain, but also to enhance their performance. And again, very easy protocol that we're able to do. It looks like this. With the FX, you can spread it out over the low back. You can also stack the green and violet here. This is actor Ian Somerhalder, star of Lost and also The Vampire Diaries, getting that treatment done on his neck and on his back as well. So you're not limited to one area at a time. This way, if a patient is coming in and they've got neck pain, mid-back pain, and low back pain, you can spread it out throughout all of those areas, and you can combine multiple wavelengths together at once to get a bigger impact. So I want to show you this because a lot of times people are skeptical and say, well, what if there's just a placebo effect? This is a video of a dog who's a patient of my friend, Dr. Juan Casillas, who's a laser veterinarian who also does chiropractic adjustments on the dogs. And this is Lucky. And you can see this video if you go to TLC Pets with a Z and type in Lucky on YouTube. He was hit by a car and his owner came in wanting to put him to sleep. Dr. Casillas checked him out and said, hey, I can fix your dog. I can do a combination of these class 2 low-level lasers and chiropractic adjustments to the pelvis, and we should be able to fix them in about 4 sessions. So here's Lucky getting the class 2 visible red laser. There are specific clearances for this laser on animals, and it does penetrate the fur. We have actual studies on it showing the effectiveness with these animals. And then he would also stack it with orthopedic manipulation. And what I want you to take a look over here is when he gets back to, you see that hind leg, how it's kind of curled under, is when you're stacking these therapies together, that's one of the great things about laser is you enhance the results of each one. So watch the way this hind leg changes as soon as he uses the adjuster tool. See a big change there, stacking them together. So he would use the lasers and these adjuster tools each day that Lucky was in the office. And this is just 4 days later. You see Lucky went from being paralyzed, trembling and scared and on the floor to, you're going to see right now at day 4, miracles happen thanks to these high energy non-thermal lasers. You see Lucky's trotting along. And here, instead of him being put to sleep, Lucky has a happy and healthy life. So I like showing that because that tells you there's no placebo effect with these lasers. And as a matter of fact, let's take it a step further. If you want to see the actual studies, this is the FX laser versus chronic low back pain. And when we did these studies, we needed patients in there who had a minimum duration of 5 years of chronic pain and at least 5 out of 10. And this is Dr. Trevor Barry. He was the main researcher on this study. He and I do lectures together. I know he's been out to Australia and taught a seminar out there for you guys before. And there's his patient, Danica Patrick, a famous race car driver out here. Now, what's critical about this is that dotted line, that's a red light device. So if you go online, you see a lot of influencers talking about, oh, red light therapy is the biggest thing, and it's just as good as a laser. The body doesn't care if it's a laser photon or an LED photon. Now, that's purely opinion, because if we do head-to-head studies where you're taking a laser and a red light or LED device of the identical parameters for the identical times, you get different results. So you see with the dotted line there, that there was a decrease in pain for this chronic low back pain with the LED. And you see the solid line is the laser. There's a good decrease in pain. But where you see the endpoint, that's where the big difference stops. And that's where the magic of these high energy visible wavelength lasers start, is that as the LED is removed, the pain starts to return. With a laser, you get long-term effects. You see that 2 to 4 months post, patients were continuing to improve even when no additional treatment was provided. And at the 12-month period, there was even greater improvement. So key concept here is if you're going to use this for chronic low back pain, the great thing is it's very easy. You don't have to have a big learning curve. You take the FX, you're going to push on a button that's the preset for back pain and surround the area. It'll do a 20-minute protocol. And ideally, you do twice a week for 4 weeks. You can do more frequency than that if you like, but that was the protocol that we used to get these results in the clinical trials. If you're utilizing a handheld, here are some pulse frequencies I like to use for any chronic condition. So I know people had questions about tendonitis or about different muscle injuries. I utilize these frequencies for pretty much all of those conditions: 8, 25, 42, and 279. Those are pulse frequencies that are great for any musculoskeletal condition. A lot of times what I like to do is place the laser in a stand. 10 to 20 minutes, 8-week protocol. Realistically, in my office, most of the patients are doing 5 to 7 minute treatments and getting great results. Key thing is I like to assess them before and afterwards. I'll have them do, say for low back pain, a squat, a lunge, if they can handle it, do their range of motion, flexion, extension, lateral flexion, then do the laser. And once you're done, immediately have them do the same thing, because since these are non-thermal lasers, they don't feel it on their body, but they can feel the change in that range of motion. And if you measure that, and if you measure their pain level, the visual analog scale, you can see some changes immediately after the treatment. And again, this is where I get really excited about the lasers, is showing long-term follow-up, that this is creating tissue healing. And that's where the difference with these lasers and some other lasers are. Many other lasers don't show a long-term benefit. They can temporarily dampen pain, especially by increasing temperature, but they don't trigger as much repair as here. These are triggering repair where, on average, the patient's got an additional decrease in pain of 17.48%. And that's with them agreeing to do no chiropractic, no physical therapy, no medications for 12 months. Huge, huge difference there. So this is where the question often comes up, because I'm talking about violet, green, and red lasers. There's a myth going around out there saying you need the highest powered device with the deepest penetration to impact a disc, like we showed in these studies. So the question is, well, how does a visible laser impact deep structures beneath the skin? So this is where we have to go back and think of the basics of light and photochemistry and photobiomodulation and photosynthesis. So we take a look on the left there. That's a person lying down in a UV tanning bed. You think about UV light, it only penetrates a few microns, which is very, very minimal penetration. Yet in that time, it can trigger a cascade to produce vitamin D production that globally impacts bone health. It's not just where the UV light's applied, but it's going to affect the whole body. And it's also going to affect immune function by increasing vitamin D levels. Let's think about a baby in the hospital. And this is a great example I use when patients are not sure about laser. And well, how's this laser going to work? As I say, hey, if you got a baby who's born with jaundice, what do they do in the hospital? They stick them under blue light, because that specific wavelength of light, not green, not red, not infrared, that specific wavelength will create a cascade of wavelength specific reactions to treat the jaundice. It'll affect the liver by not even penetrating directly to it. So visible high energy wavelengths, which is what we're talking about, high energy wavelengths of green, violet, and red, they create photochemical and photosignaling cascades. But don't take my word for it. Do a fact check on me, kind of not the Facebook version, which is not real valid, but do an actual fact check. Go into PubMed, you'll find studies like this one. This one showed that utilizing a violet, a green, or a red laser can actually modulate inflammatory mediators secreted by the annulus. And this could actually, by modulating these, can help to repair the disc and help to break down scar tissue. This is also repeated in this study here, that putting a green, a violet, or a red, even though the direct penetration is not that deep, you were still creating a cascade similar to UV light that can stimulate what are called extracellular matrix modifying enzymes. And they found that these could actually help to repair an injured disc. This is part of the reason for showing the long-term benefits with the FX for chronic low back pain that you haven't seen proven with other types of lasers out there. Now, many times doctors will ask, well, why to use different wavelengths of light? And this was a study that was done with the zirconia lasers at the University of Chicago and Illinois Medical Center. And they did this on subjects with renal fibrosis. And they wanted to test to see, could the laser actually help to stimulate repair of the kidneys? And now, The lasers are not cleared to treat that. So I'm not telling you go and treat patients with kidney failure or market for that. I'm showing you a clinical study here that's in the literature on PubMed. What they found was that each wavelength caused different specific changes in the subjects. So when they did red, 635 nanometers, and the electron voltage is 1.9 electron volts. And that's critical because if the electron voltage is above 1.7 electron volts, then it can make electrons jump to higher orbits and create photochemical and enzymatic cascades that you don't see with, say, infrared lasers that are below 1.7. So here you have an increase in mitochondrial activity at complex 4, the end stage for making ATP. You also have proliferative activity of the cells and production of interleukin 10, which is like a master regulator of the cytokine response. So here you can dampen inflammation. They found that with the violet, it was really great for breaking down scar tissue and for reducing apoptotic cells on these fibrous tissues. For green, they found a big benefit for the production of stem cells, that was the biggest wavelength for producing stem cells. So think about, there's a lot of people talking about stem cell therapy and what could be done with that. Think about what kind of an impact that can have on the body. You can also get a reduction of transforming growth factor beta. So all these positive things, and that's not the only thing that these wavelengths can do. We'll get into more a little bit later about what else they can do. But this is showing you different uses for different wavelengths. This is why I started with red lasers alone in 2004. And then in 2008, I added violet. And adding that violet, I saw a jump in the results I was getting. And then I was one of the principal investigators on the green and violet, the GVL. And when we added that one in, that was like just laser on steroids, and we saw even more tremendous benefit. So what I like to do with all of my patients is to get all three wavelengths on them. In a perfect world, that's ideally what you want to do, but you can always start with red or red and violet and still get great results. So speaking of the study, let me show you or share with you the results from our study for chronic neck and shoulder pain. And this was peer reviewed, and that's a key thing. A lot of the research that you see on laser is not necessarily double-blinded or placebo-controlled or peer-reviewed. Some of them are just case studies that a doctor has done in their office and then they present it. This was a double-blinded placebo-controlled study where the placebo wasn't even a true placebo. It was an active red light device. So utilizing the same energy, same kind of parameters. Our study was high enough quality that it got accepted for peer review, and only 12% of submissions are accepted into this particular journal. And we're able to show that the green and violet combo was more effective than red and violet, red alone, or red light therapy. And here's a great thing. So I like giving you tidbits on how to treat this. A great thing to do for shoulder pain or any pain throughout the body or tendonitis. I saw questions doctors had about foot pain, knee pain, tendonitis, wrist pain. The great thing is you don't have to learn a different protocol for each different area. You can take like the FX and the GVL and stack it together, or whatever laser you're going to use, place it on there and use these settings, 825, 42, and 279. Place the laser in a stand. In this study, we did 6 minutes for the right side, 6 minutes for the left side, and then 1 minute at the top of the head. A key thing for helping patients understand what they're getting out of the laser is doing pre and post assessments. Do their range of motion, ask them what the pain is, do their shoulder range of motion, ask them if anything's painful, have them mark it on a visual analog scale, and then do the laser and reassess it immediately afterwards. Patients should notice a change in their range of motion and in their pain in that session. Again, they won't feel the laser since it's non-thermal, so you need some different objective outcomes on here. Now, you can treat longer than that if you like, but that's the average that I'll do on a shoulder is 6 or 7 minutes for one shoulder. And if you want to make it easy to stack it, if you're a chiropractor, physical therapist, any kind of rehab specialist, physiotherapist, have them do small movements in the range of motion that doesn't increase the pain. My only caveat with that is if they're brand new, don't have them do that on the first session, because then they're going to think that their movement is what made them better. But on follow-up sessions, I like to get them active. You can have them do their rehab at the same time. If you're doing bands, if you're doing balls or weights or whatever types of rehab exercises for a shoulder or a knee or a low back, stack it with a laser. You get the best results with these lasers when you stack it with movement. So speaking of results, let's take a peek at what these results were. Similar to the chronic low back pain study, we had these patients had a minimum of pain for 5 years duration and a minimum daily pain of 5 out of 10. They agreed during the time following the treatment, and at the time of treatment, they would make no changes to their medication or do no other types of treatments at all. So we see the average patient duration of pain was roughly the same for the red group, red and violet, green and violet, and the red light LED group on there. In order to get success, study success criteria for our FDA over here in the United States, we needed patients to get at least a 30% pain reduction. So this next tab shows you what percentage of patients in that single session, 6 minutes for one side, six the other, 1 minute at the top, what percentage reduced by 30% in their pain. And it was 65% for the red laser, the accelerate, 75% for the red violet, which is the EVRL, and 81% for the GVL, which is huge. In comparison, for the red light group, only 11% hit 30% pain reduction. When we look at improvement in pain from baseline to immediately after treatment, it's roughly the same between the three. 48% for red, 45% for red violet, and 52% for green. And the LED is clocking in at only 8% improvement, average improvement in pain from baseline to immediately after that 13-minute session. Now, here's where the real magic comes in, and this is where I highly recommend considering adding in the green and violet wavelength, because what I've tended to see as I've been using violet now, green and violet, for the last 5 years as I was doing the research on it, is that we see that the biggest differences occur when the patients are out of the office, that they get this bigger decrease in pain as the hours are continuing after they're gone. So for the percentage improvement in pain from the study endpoint to 20 to 48 hours post-treatment, it's 43% improved for red, 50 for red and violet, and 65% for green and violet. It was by far the most of it. Whereas for the LED group, similar to what we saw with the back pain study, is that their pain came back. And here for range of motion, we see the biggest when we add in, we combine wavelengths. So 14% improvement in range of motion for red only, 29 for red and violet, 32% for green and violet, and only 2% for LED. So anytime you hear someone say that the body doesn't care whether it's an LED or if it's laser, that simply is not true. And again, these are randomized, double-blinded, placebo-controlled studies. And if someone says, oh, well, you have to ramp up a red light device way higher to match the effectiveness, that tells you right there that a photon of LED is not equal to a photon of laser. There are different things that occur with a photon of laser, because if you get identical results, you should be able to get them with the same dosages on here. So let's look at a real life study. This is one of my patients who came in, and he's an older gentleman, someone who could be representative of any type of practice out there. And this is a Hino. And a Hino is a refrigeration worker for Cacique Cheese, a huge cheese manufacturer out here in the United States. And he was lifting a heavy refrigeration unit over his head, and he heard a pop, felt immediate pain, couldn't lift his arm. He's feeling that pain and he can't lift his arm. So he comes into my office and I check him out. He can't lift his arm at all based on his description of the event. I assume, hey, this looks like a rotator cuff injury, probable tear on here, probable surgical candidate. So we get an MRI on him, and you can see I've highlighted the findings on this, because doctors will always ask, well, what can you do if there's a tear? So at the very least, these lasers have clearances for pre-op and post-op. So at the very least, I'll have patients come in before surgeries and after surgeries. And we can usually enhance that healing and repair at least 30%, sometimes 50%. If they're a young athlete, I've seen it as much as 70% acceleration. But here we have this gentleman who he had a full thickness tear of the supraspinatus tendon with mild retraction. And that's a key word there. If you see mild retraction, you can utilize the lasers to repair it. If you got full retraction, that's surgical candidate there. You're not going to do that as much as I did with this patient here. But he had mild retraction without atrophy. The supraspinatus also had a full thickness tear of the infraspinatus tendon with mild retraction and some atrophy, and a probable tear of the intra-articular portion of the long head of the biceps. So this is looking pretty bad. So what I did, and you'll see a picture next of what it looks like, I just had the laser surrounding his shoulder, and I told the Hino, hey, as you're sitting there, I just want you to do small movements where it doesn't increase your pain. That's the key thing. I just want to do a little bit of movement. So at first, you do a real small movement like this. And I had him coming in 3 to 4 days a week as we're trying to get him ready for surgery. And as we're going, I'm seeing this range of motion getting a little bigger and a little bigger. And so I started doing a little more active rehab with him. And by the time he gets to see the orthopedic surgeon, which was about 4 weeks later, because he was a workers' compensation patient and there's big delays in our system out here, he gets in there and he's got full range of motion, which blows away the doctor when she sees this. And she says, hey, what are you doing? Because you shouldn't have that kind of range of motion with these injuries. And he told her he was doing these high energy non-thermal lasers. And this ortho knew about these lasers. And she said, hey, this is great. I'd like to stack this. She said, I want you to come in and see me, the orthopedic surgeon, for PRP. And she would do PRP on him on, say, like a Friday, and then come back and see me on a Monday. And so she did a series of those shots where we're following that schedule. And after about 10 weeks, Eugenio got to full range of motion, no pain. If he lifted like a 50-pound weight over his head, it was 2 out of 10. So he never had to have surgery. She recommended he just continue for maintenance or performance enhancement with me on a regular basis. He'd come in about once a month, and he was able to work another 5 years in that physical job and never had the surgery. So we see these possibilities with that. And what did I do here? Back then, I didn't have the GVL yet. This was before it was developed. So I utilized the red and violet EVRL and the FX. Surrounded on the area. It's that simple. You can take these out of the box and get up and running with them. Now, there are more complicated protocols I'm going to teach you if you come out to my live seminar where we're going to get in workshops. And I'm going to show you how to very quickly change a muscle strength within 5 to 20 seconds and blow your patients' minds. And also, if they're an athlete, enhance their performance for whatever they're doing on the field or enhance their speed. But here for basic stuff, you surround the area. I use these same settings, 8, 25, 42, and 279. Do motions in the pain-free range of motion, and he did the PRP, and we had this full resolution without any kind of incident. And again, this is what it looks like. You can just surround the area. And you see we just got a little skin exposure on there for treating the area that gets the best absorption on it. And it's as simple as doing that. Now, the question doctors always have as I'm talking about these different wavelengths is, which wavelength, that's going to be which color or device is best. And really, this depends on the condition. Each wavelength affects the electron transport chain protein complexes differently. That's the key thing, is it's different. And no matter how much you turn up wattage or power, there are unique effects at each wavelength specific unique photochemical effect. And each wavelength has a specific photon energy, which are electron volts or EV. And certain EV energies are required to trigger specific reactions. So again, we'll go back to this example here. We have the UV tanning bed on the left and an infrared on the right. Now, they both are great devices here for specific purposes, but the question is, can you get the same cellular reactions with a UV bed as you would with red or infrared? And conversely, could we ever get a suntan or vitamin D production with the infrared? You can't. No matter how much you turn the power up, all you're going to do is create more photons and more heating of the tissues. You need specific wavelength reactions on here, specific energies to trigger electrons to jump into higher orbits and create a cascade of reactions. And again, that's where I talked about this. You can never trigger melanin production or help jaundice with red or infrared or even green. No matter how high you set the power only affects the total photon dose, never electron voltage. So it's a key thing is that you have these wavelength and photon energy specific reactions. And this is a key concept here for you to understand, is what we're dealing with are lasers that are between 400 nanometers and 640 nanometers on here, or 635. These are the highest energy ones. So over there at violet, each photon has 3.1 electron volts. At green, it's 2.4 electron volts, and at red, it's 1.9 electron volts. So these are all high enough to cause these electrons to jump to a higher orbit and create specific cascades. When you get into the wavelengths that are between 800 and 1064, they all fall below 1.7 electron volts, and so they can't create the same kind of reactions. They function differently. And that's what all these papers here show you. And you all will get a copy of these, or you can get these PowerPoints. I'm going to send them over to Sherelle, and you guys are welcome to the slides, so you can go back and you can take a look in more detail at some of the papers that I'm referencing. So here in the book, Laser Phototherapy, this talks about visible and infrared affect biostimulation in different ways. That visible light elicits photochemical changes, while infrared does physical changes. And visible light can produce photochemistry, according to Stanford University, while infrared produces molecular rotations and vibrations. And that's a key point for you to understand, because especially when we look at mitochondria, as we're trying to make electrons jump and move along to produce ATP, is you get these wavelength specific reactions. And an important thing for you to understand for whatever type of physician you are, is that mitochondrial health impacts every aspect of the patient's life, and mitochondrial function can be impaired by really common things that they're already on. Common pain meds, aspirin, diclofenac, gabapentin, these things can negatively impact mitochondrial function of the first three complexes. Statins will, diabetes drugs will, antidepressants, metoprolol, really common drugs will. Food additives and chemicals, also eating inflammatory foods, if you're eating seed oils, alcohol, smoking, and even a COVID infection or spike protein exposure can trigger inflammation and negatively impact mitochondrial function. Now, key component here is we got these complexes 1, 2, 3, and 4, and you see that the electrons have to move along from complex 1 to 4. At complex 4, red and infrared can help produce ATP. But these first three steps are rate limiting steps that red or infrared don't impact. And they have wavelength specific reactions. Complex 1 and 2 is impacted by violet types of lasers, and complex 3 is impacted with green types of lasers. We'll get in a little bit more into what conditions can be impacted by that, but this is particularly important for, say, like osteoarthritis, because they find that dysfunctions in mitochondria at complexes 1, 2, and 3 can trigger worsening of osteoarthritis. So supporting those complexes with green and violet laser can help provide relief for patients with osteoarthritis. And let's take a look at this, because the key thing is when we utilize these lasers, we can utilize high energy lasers differently than high power, which are thermal high wattage lasers like the class 4 lasers. It's important to understand that, because when I show you these methods, or if you come out live, we can do things very, very quickly with a low total dose and low power. And the reason is the high energy. This is a study done by the Russians and Russian researcher Sergei Moskovin. I highly recommend you go into PubMed and read his studies. He talked about for bronchial asthma that if you used a high wattage infrared laser that had low power between 800 and 1064 nanometers, you have to go directly over the lungs, because that's going to create molecular vibrations and rotations and a thermal impact on there. But they said that what the Russians would do is they use the high energy wavelengths differently. You can go over the large arteries. You can go over the subclavian artery and deliver the energy to the lungs that way. So a lot of times if I'm working on a patient with a brain issue, I'll hit the carotid artery, because then we'll activate brain pathways, because then the laser energy is going to get everywhere. It gets picked up by some free floating mitochondria and starts to go and infiltrate these areas to repair tissue at deeper structures without deep penetration. So they basically, key thing for you to understand, the high energy, low power, visible wavelengths of green, violet, and red can be used differently and with lower power than the low energy, high power class 4 infrared wavelengths, because this always creates confusion, because when they see us using it from a distance or using it like above a cast that's broken to get a bone to heal, with a high power laser, you got to go right over that area. Here we don't. We can go to the blood supply because they work differently. And that's where it reminds me of one of my favorite products that have come out of Australia is Kath and Kim, where she'd say it's nice, it's different, it's unusual. And these are different, they're unusual, they're different than what you're used to. And they're going to work differently, which can allow you to do this in a kind of better type of a manner here. Because these can be done over these large blood vessels. They'll also propagate through the microtubules, through the myelin sheaths, and also through the water content of the body, which is 92% in the blood, 75% in muscle, and 73% in the brain. And the violent ends of the spectrum really propagate further through the water than infrared and have less thermal effects. So we create these photoelectric and photochemical signaling events and electron jumps that can't be triggered by lower energy infrared wavelengths. So visible and infrared work differently. I just really like to hammer that so you understand this, that because there's almost a war between the high energy and the high power wattage ones. And really, you can have both in your office and just use them differently for different conditions. So I know we have a lot of podiatrists that are on here too. So I wanted to show you this regarding the laser versus chronic heel pain and plantar fasciitis. Is again, we have another study that was double-blinded, randomized and placebo-controlled for plantar fasciitis. Now, a really cool thing about this one is the group that went through and got the LED treatment, they later on took them through and then gave them the laser treatment, so they became their own control. And again, like with the other studies, we showed long-term benefits with these lasers, where you see that doing a treatment twice a week for 3 weeks had a great drop down in pain, but they even saw benefits at 6 months and 12 months post. So here's the treatment protocol you do. Very simple. Place the FX on the preset. You just push heel pain. It's a 10-minute protocol. You do it 2 times a week for 3 weeks. For the handhelds, I again like to use 8, 25, 42, and 279. Now you can get more complicated and fancy and do some different things, but again, I like to keep things simple so you can, kind of replicate things without bogging down your office. You place the laser in the stand, do say 10 minutes for a 6-week protocol, and that also works well. The difference you'll see is if you have the FX, you'll get a result in a quicker time as far as total weeks of treatment on there. But you can still do the same things with a handheld. I started off my practice with a handheld and got great results. Now I have the FX plus the handhelds to enhance them. And this is what it looks like. So here you see on the left, this was a patient that came up to me when we were doing an event at a chiropractic school, and she had 8 out of 10 pain in her plantar fascia for several years. Cortisone injections didn't work. They wanted to go do the surgical release. She wanted to avoid that. We did one 10-minute session, and in that one 10-minute session, it knocked her pain in half. She was actually able to walk with her foot even going flat, where beforehand she was walking on her toes. Now, a cool thing is you don't have to do it even hitting the bottom of the plantar fascia. When Erconia did their studies on this, they did it hitting the arteries in the lower leg. So literally, when they did the studies on the right, you can see that's the position they had. It was with the foot up, and the arteries will pick up the energy from the laser and deliver it to the tissue to actually repair the tissue. So key concept there that it's very different. You can also use this for like peripheral neuropathy types of cases when they're in your office. I just completed clinical trials on peripheral neuropathy, so hopefully that'll be the next clearance that we get. But we had some really good results, again, comparing them to an LED device that showed the laser being superior. Now, I know we've got some medical doctors on here and some nurse practitioners. I wanted to share with you, too, a really cool secondary effect that the violet lasers have is that there are these studies. Now, I'm not saying that you use this as a replacement for standard medical care, but there are studies on violet wavelength, even though this is blue. Blue is actually 470 nanometers. This is violet at 405. They just kind of misnamed it. These violet 405 nanometers were shown to be effective for patients with COVID-19. And that's a really cool thing. There's studies, if you go into PubMed, that shows it's got a 92% effectiveness rate versus MRSA. And that's really amazing. So if you got a patient coming in for pain, they're also going to get support of their immune system as a secondary benefit. And Erconia's lasers have specific clearances here in the United States for fungus that creates nail fungus and for the bacteria in acne. But go into PubMed and read about violet or blue wavelengths of lasers, and you'll see there's a lot of studies suggesting that they are antimicrobial. And for you podiatrists out there, again, this is where we have the clearance for toenail fungus. And I want you to pay attention to a key word here that they've trademarked. They call it laser pharmacology. So again, these lasers work differently than the high-powered lasers. We're not trying to do a thermal impact. We're not just trying to increase temperature. We're actually trying to trigger a cascade of reactions that they call laser pharmacology. And in this study here versus nail fungus, they were able to show that it beat standard medical care to where 12 months after the treatment, the clinical cure rate was 95% of the subjects, and 100% of them had improved nail growth. And this is what that looked like. So here you have it on the left showing you before and afterwards on the right. On the right one, that's a sequence of showing one patient going over the course of 4 months for their treatment, after 15 months, sorry. And you can see the improvement there. And these are long-term benefits because the laser has that ability to produce vascular endothelial growth factor to actually repair blood vessels and improve blood flow to the area. That's where you're getting the long-term changes because now your body's immune system can get to that area and continue to keep the fungus at bay. Now, key point I want you to understand, because there's people who get really into dosages, and you'll see some companies will say you need the highest dose possible that gives you the best results. Well, that may be true for an infrared low energy laser, but when we have high energy lasers, you don't have to do that because Stanford University found that in principle, one photon can activate one enzyme molecule, which in turn can process many thousands of substrate molecules. And if the effect of one photon can be amplified biologically, then one does not need a lot of photons to produce an effect. The key thing they said here is you just need to find the proper wavelength of light to stimulate the proper enzyme, which in turn will stimulate the beneficial therapeutic effect. So I want you to understand that if you come out to my live seminar, you will see some things we do will change a muscle's function literally in 5 to 20 seconds. And this is how we're able to do it, was by creating this signaling and communication changes in the body. And a key thing for you to understand, every second that an Erconia laser is on, there's not just a million photons coming out, or a billion, or a trillion. There's over a quadrillion photons. So like, let's say if you got 99% blocked by something, by clothing, or blocked by the bone here in the front of the head, you're still getting trillions of photons coming through per second. So if you do a 60-second treatment, you're getting potentially 60 quadrillion photons that are coming out. And that could be creating 60 quadrillion reactions on there. So that's for you to understand how these lasers can make such an impact in a short period of time. And if we look at recent study here on photosynthesis from Science News, one photon's all it takes to kick off photosynthesis. You're kicking off a domino effect of reactions. So here's a key concept. I know I'm going through a lot of material very quickly. This is like the sampler plate, the appetizer for the live event I'm going to do, trying to give you an overview of different concepts of where we can work on. I'm going to show you a few case studies coming up in the last like 10 minutes that I have, and then it'll be open for questions. But the key concept that and take a picture of this if you want. Doctors always ask, well, what does each color of wavelength of light do? And there are studies to back up what I'm claiming here. I just don't have time to take you step by step on what the studies are. They are in my notes, though. Violet is the best for antimicrobial support, scar tissue breakdown, vascular endothelial factor support, and the balance between the sympathetic and parasympathetic system, especially when you pair it with red. You get a nice balancing effect there. Green, by studies, is being shown to be the best for collagen production and elastin. Think about a lot of cosmetic surgeons will use this for regenerative medicine. They'll use the green wavelength for different tightening of skin. It's best for chondrocyte stimulation, stem cells, bone and nerve regeneration. Red is the best for the final step in the energy chain, interleukin 10 production, which is that master regulator of inflammatory cytokines, sympathetic and parasympathetic support, and cell proliferation. So my favorite is to use all three. If you can't use all three, my next favorite is use red and violet together. And then your starter pack is just using red. Getting red on, you'll still do some amazing things, but you'll get better and best with each way you step up. So important concept here to understand is that when you get a laser on a person, these are some of the things that are going to happen. If you got a patient with Hashimoto's, you're going to decrease their thyroid antibodies. That's important because those antibodies can cross-react with the brain and the cerebellum specifically and create problems there. You're going to stimulate glutathione, which is a majorly important antioxidant. You're going to improve vascularization, repair blood vessels by VEGF production, and improve blood flow by nitric oxide production. So we think about a lot of athletes will use NO-Explode and other things to enhance performance, or a lot of males with erectile dysfunction will utilize, Viagra for that kind of performance enhancement. Nitric oxide is what those are trying to do, and the laser will help you to produce nitric oxide. You can dampen autoimmunity, stimulate T regulatory cells, modulate immune cells in the brain like the glial cells, and stimulate stem cells for liver production, for fibroblasts, for blood vessels, etc. A whole ton of things that we'll cover in greater detail in the live seminar. So many of you I know are, again, medical doctors or nurse practitioners on here, and you may be wondering, well, how does this compare to NSAIDs and opioids? This was another paper that I was a co-author on, and we compared as a review of papers study on here, the effectiveness of laser to red light therapy, NSAIDs, and opioids. And the great thing is that laser was shown to be superior to the pharma options because you had no side effects and you actually triggered long-term tissue repair, which was really huge. So thinking about this too, when you get the laser on, you're going to produce stem cells, especially mesenchymal stem cells. Any of the wavelengths will do it, but the best one is mesenchymal stem cells. So if we put a laser on the brain, you're going to stimulate these in the cranial bones, and they're going to migrate to the brain, infiltrate, and help to clear out some of the amyloid beta and tau protein malformations, thus enhancing brain performance for these patients. It's anti-inflammatory. Any of the wavelengths are anti-inflammatory on here. And think about this, what does inflammation cause and what causes inflammation? We know infections, so that's where if you're providing support with a violet laser, you can help to dampen inflammation. Injuries, so an injury repair can trigger inflammation, and inflammation can trigger worse pain too. So the lasers can repair these things. Diabetes and obesity. Now there are studies, if you go into PubMed, that show that red and violet lasers can help to support healthy blood sugar levels. And we look at all these different things. Inflammation can trigger inflammatory bowel disease, allergies, asthma, arthritis, Alzheimer's, cancers, joint pain, eye disorders, cardiovascular diseases, and gingivitis. Now, I'm not saying the laser is a cure for all these or treats all these, but understand when you put a laser on one of your patients who may be in there for an orthopedic or musculoskeletal condition, you may be providing secondary benefits for these other types of conditions. One of my favorite things that laser does when you get it on the head is you produce brain-derived neurotrophic factor, which you think of that as like miracle grow for the brain. It's stimulating like fertilizer for the brain. And this is showing you an example of a kid that I had as a patient who he had drowned for 10 minutes and had made no progress with any physical therapy. And he would spend 3 weeks of every month in the hospital with infections. So we started just to try to help provide some support with him is we were lasering with the red and violet over the gut to try to support healthy gut function, support the immune system, and then the laser on the brain. And we try to do some stimulation to different brain pathways through percussion or through different movements. And the great thing with this kid, River, is that in the next 6 months, he spent no days in hospital. He didn't have any more of those infections. So we provided support to keep him healthy, which that greatly improved River and his dad's quality of life. Clearly it didn't heal him, but it helped to improve their quality of life. So another thing that the lasers can do is especially green and violet, green being shown to be the most effective here for this, is supporting healthy bone formation. So if you got a patient with osteoporosis, you got a patient with a fracture, and you put these lasers on them, you can stimulate osteoblasts to try to repair the tissues. You can do it with any wavelength of laser, violet, green, red, or infrared, but this study shows that green was the most effective of it. I like to really stack the three wavelengths together. I mentioned earlier about osteoarthritis, and again, this is showing you with the problems that complexes 1, 2, and 3 are a big factor in osteoarthritis and in the development of it. So this is where if you get these lasers on that patient, the violet can support complexes 1 and 2, the green can support complex 3. You can dampen inflammation. You can stimulate stem cells and you can get to repair the tissue. That's just by sticking the laser on there. So there's nothing fancy you have to do. Now you can enhance it by having them move the joint in a pain-free area range. You can get in there and do soft tissue work with your hands, with whatever tools you want to use. You can stack a PMF device, ultrasound, electric stimulation. You can stack any of these things together and get an enhanced result. So let's look at a case of this. This is a knee degenerative joint disease case. And this was my mom. My mom, when she was 80, was recommended when she was in her 70s, she was recommended for a knee replacement. She didn't want to do this. She did have bony degeneration. So we utilized the laser, lasering her lumbar spine and lasering over the area while she did little ranges of motion. I also used a percussor around the tight muscles, the areas where she had some scar tissue and adhesions, did some kinesiotaping, put her on an anti-inflammatory diet. And what happened with her is we were able to avoid her having a knee replacement for 7 years until she got in a car accident and her knee impacted the dash, and then the damage was too bad to where she had to have surgery. Now, the awesome thing we did then is we did pre-op and post-op on her. And for being in her late 70s, they said she was at the 1 month mark where most patients were at a 6 month mark. And again, this can be as simple as just sticking the laser on there using these settings. So it's not like a steep learning curve. This is what it looked like when I partially tore my meniscus. And I was at a seminar where I was having trouble walking. So I'm kinesiotaped there. You don't have to take the tape off because again, I'm hitting the skin in other areas. It's getting picked up by the circulatory system, delivered to the deeper tissues. I'm doing little leg extensions there while the laser's on, and that's helping the tissue to actually repair. I know some of the people on here are also hand specialists, and they want to know about carpal tunnel. This works great for carpal tunnel. I'm going to show you a little video of what it looks like. So, and this was shot during COVID where we had to be masked up in here. And this patient was coming in for carpal tunnel from a lot of playing the video games. And so here I just surround the area. Ideally, I would do this with the FX also on his arm in a stand, or it'll snap right into that little groove you see between there. And I would use the percussor at the same time to release those areas of fibrous adhesions that would normally be released during surgery. But as we know, after surgery, those can come back. If I release them with this, we're not really going to get them to come back. Now you can look at this and say, oh yeah, but you're blocking some of the laser. Correct, I'm blocking some of the laser, but look at how much is hitting the blood vessels in his upper arm or in other areas. And now I'm also going down, he had a trigger finger that we're going to work on. And so I'm working on his trigger finger while the laser is applied. I like to do these at the same time to save the patient time and to save time in my office. Now, whether it's a knee, a shoulder, a low back, or whatever, you can do that same type of a protocol. So you don't have to be thumbing through a book to see a manual on how to utilize this. I will show you more advanced techniques that are the most effective ones in the live seminar where it's hands-on. You're going to get into groups and you're going to work on each other. But this is how you can work these things right out of the box. I know some doctors ask, what about for wounds? So whether it's a car accident, a motorcycle accident, or whatever, a bite or something, this was one of my patients who's a college softball coach, and she took a softball at 70 miles an hour into her shin, and poof, you see it looks like a gunshot wound there. They thought she was going to need to have a skin graft on it. She said, no, I'm going to go to my doctor. He'll get this fixed up with his lasers, because I had fixed her old knee injury. She's a coach who's like 60. For like 15 years, she could barely bend her knee. With a laser, I got her to almost full range of motion, about 90% of normal. So she was a big believer in the laser. I put the FX, and at the time, the green and violet wasn't out yet, so I used the EVRL on there. And you see on the left is the original one. On the right, up top, is her after 4 weeks of twice a week. Now, down the bottom, you see another one. That's because about a week after we started doing treatment, she took another ball into the shin. And it happened to be the same shin, but that's where it's great that we have this line-generated beam, because then we can spread it out over that whole area. So That concludes my portion here. I do want to remind you all, I know this is like breakneck speed. When we do the live seminar, we're going to go a lot slower and take things through to explain things better. But I wanted to give you a big overview, what you can do with the lasers. I invite you to join my group on Facebook, Dr. Gair's Laser Therapy Treatment and Marketing Secrets. We got over 2,000 doctors around the world. That way you can continue the conversation.
Once again, Kirk, thank you so much. You're a wealth of knowledge.
Thank
Um,
you.
and that was really insightful. I know a big jam packed full of information in that 60 minutes, which is
Jam-packed.
great.
Yeah.
But just letting everyone know that that's not going to be our only sort of, events. We have a big one coming up, which I really want everyone to know about. It's our enhanced workshop. Look, so anyone who's really wanting to, learn even more, and we've got a really exciting workshop. It's on 24th and 25th of May in the Gold Coast, and Kirk Gair himself is going to be there in person. It's a 2-day event. Also, we're going to have Brett Joros is going to be there as well, I'm pretty sure. So,
Yep.
seriously, this is a great opportunity for everyone who's really interested in the low-level laser industry. I admit I've been to 2 of these workshops, and there's nothing like it. They're the most advanced workshops you can get in Australia, and they're just great. They'll get you up to speed with everything. And there's only one this year, so that's a must attend. This is the only one we're doing this year, so that's coming up. So put that down in your diary. You can get that onto the website on reacare.com, go into events, and it'll be just there for you guys to register. Also on that, we've also got some other workshops coming up. We've got a great one if you're in the Sydney, Crow's Nest area, New South Wales. It's a 3-hour workshop on lower limb pain, so great for physios or podiatrists. They got right into a workshop there. Kirk's also got another webinar coming up. That's on the 2nd of April. Now, this is going into the evidence-based side of neurorehabilitation. So any chiros or any physical practitioners out there that are in the neuro space, that's another one that you definitely want to attend to. Some really great stuff there. And also the week before our enhanced workshop, we've got the Sports Chiropractic Symposium. So that's the week before. We're going to have a booth there. If anyone's interested in coming by, checking out some of the lasers, we'll probably have all the lasers there for you guys to check out. And if you've got some questions to ask, we're all going to be there. So that's a great chance to sort of come by and meet the team and talk about it even further. There's some great things coming up. Once again, thank you for everyone attending. We really hope you got some great information out of that. I know I did as well. And Kirk, thank you as well. We'll see everyone soon.
Hey, thank you guys for having me. Looking forward to coming out.
Thanks, guys.